Hello, Dr. Brian Abelson from Kinetic Health. We're going to go over a pin and stretch technique for your elbows. You can use this for treating tennis elbow and golfer's elbow, otherwise known as lateral and medial epicondylitis. Now, what we're going to do here is we're going to first basically show you the area. Mickey, why don't you just show them exactly what we're talking about here from the area. Now, when we're doing this exercise, we're going to actually get our fingers and we're going to pre-stress this area just a little bit. So if you look at the elbow on the outside here, just up from the side here, pre-stress it down here. Okay, are you feeling that there?
Yeah.
Good. And the actual action with our arm we're going to do is actually we're just going to go like this and bring it to the side. Okay, so let's just go over the action first before we actually put any tension on the elbow. Okay, so it's going to be like this. And some of these are going to be dynamic, and then we're going to do a static stretch. So when we're doing this exercise, we get our fingers on here and we pre-stress the area. Now, is that pretty sensitive in there?
Yeah.
Okay. And then we want to take it out, keep the tension on there, and a little bit of compression.
Okay.
Bring the arm out, and straight out from that point there. You feel that?
Yes.
Quite a bit? Okay. You'll be surprised actually how much force you can generate on this area.
Yeah.
So let's just do some dynamic ones. We do this about 5 times, let's say. Take it out. Good. How's that feeling there?
That's good. It's
Right
starting to relieve a little bit.
Okay. Keep going on that. Good. And you're keeping that stress so that you're taking your fingers and you are pulling up in this direction here and keeping compression on the area. Okay. One more time and just hold the last one. Good. So you're keeping this so you're actually stretching in and you're keeping your fingers so you're kind of pushing up in this direction. You feeling a good stretch on that?
Mm-hmm.
Good. So this is what you'd actually work on, the lateral epicondyle, what we call the common extensor tendon, and this is involved in tennis elbow. Good. Okay, the next section we're going to go over is for the inside of the elbow, or the medial epicondyle. This is where you have problems when it comes to golfer's elbow. Now, this is a very, very sensitive area in here. So you're going to take your thumb, and you're just going to find this area on the inside of the elbow. So right around up there. Pretty sensitive in there? Okay. So what we're going to do here is we're going to get in there a little bit. It's going to get a little bit tender, and then we're going to traction it up like this, okay? And then we're going to take straighten the elbow out, and right up like that. Feeling that quite a bit?
Yeah.
Okay, back up again. Okay, not too much compression because this is a really sensitive area. Okay, so let's do about 3 more dynamic movements on that. You really feeling that in there?
Especially at the end of the movement.
Okay.
That's what I feel it the most.
Yeah, at first you're just kind of preloading and getting compression, but at the end there you can really feel it. Okay, one more time. Good, right out. And just hold that position.
Okay.
Okay, you feeling quite a bit of tension out of that area?
Yes.
Okay, good, good. Okay, so we do about 5 dynamic pulses and then we hold it statically for about 10 seconds. Same thing, if we're working on the inside or the outside of the elbow. Really good. The next thing I want to go over is actually working on both of these areas, but creating some shear stress on the area. So let's go to the outside first, and essentially we're going to just get on the outside and kind of work across here. Okay, work all the way across so we actually create a shear stress. The fibers of these muscles come up and they attach along here. Now, if we're going to get in there and actually break up restrictions in different layers, we want to make sure that we actually move across here. There's some little muscles here, like I call the supinator on the edge of the corner here, and something called the inconius, which assists your triceps. Now, if we're going to get into these muscles, we're going to have to actually work and do some cross fiber massage. Do you feel that?
Mm-hmm.
Okay, but you got to get in reasonably deep.
Yeah.
Now, this is also something you can assist somebody with. So if you want to get on the area, you just kind of get in there and work back and forth.
Mm-hmm.
Feeling that?
Yeah.
Not too deep though.
Not too deep, no.
Okay, good. And if you're helping somebody out here, you want to be on there for several minutes. And this will help to break up restrictions, get rid of waste byproducts in the area, increase circulatory function, get more oxygen, and really speed the healing process. Same thing when it comes to the inside of the elbow. So we're going to go on here now. This is a really sensitive area. So if you're taking your thumb on here, you've got to be careful. You feeling that quite a bit?
Yes.
Okay. Same sort of thing. We go across this way because a lot of the muscles from the forearm, they actually come up and they connect on here called the common flexor tendon. Now, we do this if we're actually treating golfer's elbow or medial epicondylitis. This is a great technique for actually just getting in there and kind of working around the area. And again, we get on there and work the area for several minutes.